neurofibromatosis. You ever heard of it? Well, if you have, you know how rare this disease is. I certainly know a lot about it because of Mila Roomberg, the daughter of our executive producer, Jessica. NF1 is what it's commonly called, is a genetic condition that affects each person differently. And for Mila, little Mila, she had an extremely rare case and a severe case involving vascular issues that led to high blood pressure. And so in 2019, she underwent a surgery that was supposed to save her life, but she did pass away 2 days after the surgery, and she was just 17 months old. And now I'm learning about two friends, really close friends, both families battling NF, and they have two sons. They're 2 years old each. It's Max and Charlie. Here's their story.
Cheese.
Little Max Levinsky and Charlie Gross are both 2-year-olds. On the outside, they are playful, energetic toddlers. But on the inside, they are battling something no child should have to endure. When Max was just 9 months old, his parents pointed out to his pediatrician some large birthmarks they noticed on his skin. Around the same time, Charlie's parents also noticed similar birthmarks on his skin. Both children received genetic testing, and Charlie was officially diagnosed with NF1 just before Max. Charlie's road has been a bit tougher than Max's due to a neurofibroma on his eye, but you'd never know it.
You did it.
And both boys are by each other's side, laughing and smiling throughout their lifelong battle.
Well, the families are with me now. The Gross family. There's Lauren. I see Brandon, Charlie. Is Michaela there? It's total chaos.
This is Michaela.
Hi, Michaela.
Charlie's right here.
And the Levinskys. I see Ellen, Justin, and Max. There you go. Everybody's in the frame now. Thank you all for being with us.
Thank you for having us.
Charlie.
Thanks for having us.
I can see that, yeah. So he's had that eye issue. How long has he had the eye issue?
When he was born, we noticed that his eyelid was drooping down, and when I was at the hospital, I had asked the nurse about it. They had mentioned that he was just sleepy, but it persisted for his whole life. And about 6 weeks, we went and saw a specialist for it.
So how long ago was the NF diagnosis then?
It took about a year for the specialist to bring up NF to us, and he was diagnosed at 14 months. He was diagnosed.
Yeah. It's a blood test, isn't it?
Yeah, we had to take him for a blood draw.
Hi. And I know it takes months to get the results back. Let's talk to Max a little bit here too. Ellen, maybe you can answer this question. The symptoms seem to be all over the map. I mean, it's the only thing that I see is a common denominator sometimes are these birthmarks. What other symptoms does Max have?
For the most part, we have been lucky. There have not been any major symptoms. We noticed a few walking or talking delays, but they all pretty much caught up rather quickly as well. So at this point, it's a lot of maintenance. We have to see the doctor once every 6 months. We check his eyes once a year. Hopefully, stays on the baseline and we don't see anything extreme popping up.
Yes.
Yeah, we have on the screen right now. Let's leave that up for a while because these are some signs and some symptoms, but each case seems to be so different. Justin, do you realize after this that you have NF?
I have not been tested, but I think I probably should. I do have a few symptoms like the birthmarks that I probably will go get tested just to verify whether I have it. But I'm 38 years old. It hasn't really stopped me from doing much.
So it is survivable.
Yes, very survivable.
Yeah. Okay. Who's the person who's going crazy here? Is that Charlie?
Charlie did. Yeah, he wanted a yogurt.
Charlie's left the frame. So, Ellen, I understand that, I hope you don't mind that I reveal that you're pregnant.
Yes, I'm pregnant. I'm 31 weeks.
Congratulations. Now, is there any way
Thank
to
you very much.
test the child in your belly for NF?
I did just discover yesterday that you can check while at the beginning of my pregnancy, but we're going to try to check as soon as we have her.
Yeah. I think I should go back to Max's case. Ellen or Justin, when did you first feel like, hey, something's not right here?
Honestly, just when we went to the pediatrician's appointment and they took a look at the birthmarks, and I had never even heard of NF1 before that. And they said, oh, it's something to take a look at. You probably want to go get tested. So that was around the 9-month appointment. And from there, COVID was in full swing. So a lot of virtual appointments, and it took a while before we were actually able to formally get him tested.
So what is the plan for Max? What is the prognosis that the doctors have told you about?
Just to continue watching on him and checking going in every 6 months. And if we see anything unusual, to contact them right away. They said it's going to be very, very obvious if something shows up, and we would know.
Yeah, we would probably see something that would tell us that it's something more than
right.
It is at this point. But other than that, it's 6-month appointments every 6 months, eye doctor once a year, and hope for the best.
Yeah,
Just
Lauren,
keeping a track
Brandon,
on
how about Charlie? What did the doctor say? What's the prognosis?
He's got a good prognosis. He's currently on a MEK inhibitor to decrease the size of the tumor. And it's looking like there has not been any growth, which is good. And hopefully it gets smaller as he continues on the medicine.
Yeah. Well, the best of luck, we're praying for your families.
Thank you.
And I guess it's a little bit of help to have the support of two friends. You're close friends, but this is such a rare disorder that the two of you are going through the same thing.
Yes.
Of course, you're going to be at the walk,
so
right,
crazy.
in media?
Yes, at Rose Tree Park. Yes.
Okay. Rose Tree Park this Sunday. And, let's make some money. We need to raise awareness about this rare disorder that not too many people know about. Thank you both for being with us.
Bye.
Thank you very much.
Say bye. Thank you for having us.
Bye, Michaela.
Bye.
Bye, Max.
Bye.
Bye, Charlie.
Bye.
We'll be right back.